Hello, my name is Jaudaun Eldridge of the Eldridge Agency, LLC, and today I'd like to talk to you about Medicare, H.M.O, and P.P.O plans. You may have gotten into conversations with friends or family who talk about how they've enrolled in a P.P.O plan and it's the best, it's the only one that you should enroll in. Well, maybe today you were the one sitting there scratching your head internally going, okay, that makes sense, but I don't know why. Well, hopefully today I can help you with that and sort some of these nuances out for you. So we have two different types of plans as they're administered. Traditionally, these are going to be your Medicare Advantage plans. You have an H.M.O, which is a health maintenance organization, and a P.P.O, which is a preferred provider organization. They have a couple of nuanced differences. The main one, let's start with H.M.O. HMOs use your primary doctor as your gatekeeper, or better yet, as your quarterback for all your health insurance needs. So they're responsible for making sure that you're getting the best health care as possible for you in your situation. They make the referrals to the specialist, the cardiologist, the pulmonologist, the ear, nose, and throat doctor. You're going to see your primary care physician before you go see any of these other professionals. And what it allows the primary care physician to do is to make sure that nothing's getting dropped. You're seeing the professionals at the right time for the right reasons, and there's no miscommunication. Everything's coming right back to them. And again, they're coordinating your healthcare plays to make sure you're getting your best healthcare. All right. Now, by agreeing to sign up into a contract for an HMO, you're going to offset a lot of your costs because you're allowing that primary care doctor to run the plays in your healthcare for you. So you're going to notice a lot of your copays, primary care specialists, your copays for hospitalization, the way the plan is administered are typically going to be quite a bit lower. Again, the premise there is hopefully your primary care physician is doing a phenomenal job and really controlling your medical needs as well. Again, the premise there, we want to see you getting your best healthcare needs met, right? We want to keep you healthy, not get you healthy. Big difference between those two phrases. Now, a P.P.O, the preferred provider organization, these give you a little bit more freedom of choice. Again, contracted network of doctors that you're going to go see as much as possible. And when you see those doctors, you're going to have a slightly higher cost share in those copays than you did in the HMO. But now you're going to get a little bit more freedom. And that freedom is going to allow you to go see doctors and specialists and or facilities outside of the network. All right. Now, there's a caveat to this. Those doctors and hospital facilities have to agree to not only see you, but bill your insurance provider as well. Take an example, very common insurance carrier nationwide, United Healthcare, not picking on them, but for this example, if you have a United Healthcare plan that's a P.P.O. and you decide to go to a hospital that's not in network, you need to make sure that hospital's willing to bill United Healthcare for whatever you're being seen for outside of an emergency, okay? Now, when you go outside of the network, as is typical of a P.P.O, you're going to have a much higher cost share when you access services. So those doctor visits or hospital visits can be quite a bit more expensive. Your out-of-pocket maximum will also increase with the P.P.O, okay, over what you would have had in an HMO. So a lot more freedom comes a bit more cost to you. Now, the benefit of a P.P.O compared to, or in essence, why would I take one, is when you compare the premium cost of a Medicare supplement, also known as a Medigap, the P.P.O can be a great way to access your healthcare, getting both in-network benefits, out-of-network benefits, freedom to go see doctors and hospitals as you see fit or as you feel necessary for a slightly higher cost share, can be quite a bit less expensive than going the traditional Medigap route in certain circumstances, okay? The math would need to speak for itself at that point. So accessing your healthcare through a P.P.O versus doing a traditional Medigap, what we might find is for the typical individual who doesn't need a lot of medical needs to be met, however, they want to have the option in the future without paying a high monthly premium, that's where the PPO makes a lot of sense. Also, in the more rural markets where you may not have a large selection of doctors who we consider to be in network. So PPOs can make a lot of sense that way. Now, again, they are going to be a little bit more costly than the H.M.O. because we're not necessarily relying on that quarterback. We don't need to have that referral base. So hopefully that helps you, the difference between an H.M.O. and a PPO. And after hearing this, and you're still kind of curious what might make the most sense for me, or what does make the most sense for me, please give me a call. You can call me at 775-328-1197, or reach out to me and fill out a contact me card at my website, www.eldridgeagencyllc.com, and you should see that on your screen below as well. My name is Jaudaun Eldridge with the Eldridge Agency LLC, but you can call me Jay.